The South African Medical Association has described the brutal murder of a Soweto doctor in front of his patients as senseless. Dr. George Koboka was killed by 4 gunmen on Friday at his surgery in Diepkloof, Soweto. It comes a week after he was robbed at the same practice. Let's speak to the chairperson of the South African Medical Association. That's Dr Mvuyisi Mzukwa, who joins us via our video link. Dr. Mzukwa, it's great to have you with us on the program, albeit under these difficult circumstances and this horrific story.
Good morning to you, Michelle, and to your viewers. Thanks for having me in your program. First of all, I would like to, on behalf of the South African Medical Association, pass our sincere condolences to the Koboka family regarding the passing of their son. We are honestly shaken, anxious, and also angry at the same time that we are experiencing, such a tragic death of our colleague who has dedicated himself, to serving his community. And knowing, Michelle, that we're coming out, or we're still in the pandemic, where as frontline workers, we stood out there armed with scientific knowledge, protecting communities, protecting the country. But now the country cannot protect us. We cannot be protected by our own communities. Our cluster, the security cluster cannot protect healthcare workers, who are really an asset in this country. We are really disappointed when it comes to that, and we believe that we are now sick and tired of these empty praises that come from government that yield no fruits in terms of protecting healthcare workers, both in private and in public.
Yeah. Dr. Mzukwa, we're playing the CCTV footage for our viewers this morning of the doctor's room in Diepkloof in Soweto. These 4 gunmen coming in, and very clearly they are approaching each patient who is waiting in line there. And you can see the patients running off there as they hear shots ringing out, no doubt, in the doctor's office. I mean, he's been described, Dr. Koboka, as a respected and loved physician in his community. What is the signal for where we are as a country, where someone like this, someone who's so respected, who's doing a service to his community, is also at risk?
I think it's a clear sign that there is no regard for the progress of this country. You will know that some of our colleagues have left this country to work in other countries. It's not just a story; it's something. It's real. And we've got some of these colleagues who have said, "No, we're not going anywhere. We want to be here in the country. We want to serve in South Africa because we're educated here. We used public money to be educated. We are not going anywhere." But instead, of communities appreciating that, they are getting killed, they are getting murdered by communities that they are meant to be protected by. We are really shocked by this attitude, that you can just go in a doctor's room and kill a doctor with patients waiting to be seen, to be serviced. We think it's very senseless, insensitive. I don't know how to describe it.
Yeah, absolutely. It's so incredibly shocking, and watching the CCTV footage now, even more so, Dr. Mzukwa. And of course, what this does now is it leaves a hole in that community, insofar as the work that Dr. Koboka had been doing.
Yes, those patients, you remember, that's doctor-patient relationship. It will take time, for those patients to get used to another doctor. But, remember, doctors will be hesitant to take over that practice. Because, when the place is regarded as high risk, you are hesitant to go and serve those communities. That is why at times you find communities without doctors, because they are high-risk areas for healthcare workers. So that is why we are saying, if you don't protect healthcare workers in your communities, it's amazing that if a healthcare worker, like if a doctor had done something there, something, that caused adverse event, it will be out there in the media. We will have all these community members coming out, marching against a doctor and all these things. But you do not see the same reaction that, when a doctor is killed. You see angry communities expressing that anger in public. We think there should be a balance on these matters. Where a doctor has done well and where a doctor needs to be protected, we need to do that. We're saying the same thing in the public sector. When people can just come in and take away doctors' possessions, healthcare workers' possessions, and there's no consequences. There's absolutely nothing. They can just do as they wish. And it's not just one occurrence. It's repeated incidences where healthcare workers are just ambushed. They're just robbed in the premises. And there's no consequences.
Yeah, certainly. And I mean, the same could be said for our ambulance services as well. They face similar threats to their lives in carrying out their duties on a daily basis. What is SAMA now doing in terms of appealing to its members around their safety when they are in practice?
Well, the first thing is that we had started a process, where we said, let us have the security cluster, where we can discuss these matters on how to protect healthcare workers, those that are in public and also those that are in private. Unfortunately in this country, when there's an incident, everyone wants to do something. But when that momentum dies down, then everybody is going back to whatever they call normal. This is the same thing that we're experiencing. Whenever there's an incident, everyone wants to come in. Now we need to be consistent. We need to have a plan. We've started with the Gauteng province where we said, let us discuss these matters when there are no incidents. So I think in this case as well, we are still going to press on to say, we continue to see our healthcare workers dying, and we need to have these discussions and a plan that must come in to protect healthcare workers. Now it's time for communities and the security cluster to protect healthcare workers.
Absolutely. Dr. Mvuyisi Mzukwa, as always, a pleasure talking to you. Thank you for giving us some of your time this morning. He is the chairperson of the South African Medical Association. And that video that's playing there on the side of your screen, the CCTV footage, the moments before Dr. George Koboka was killed by 4 gunmen on Friday at his surgery in Diepkloof in Soweto. It appears that they started by going from patient to patient, demanding their belongings, and then you can see patients running out of the surgery there when shots ring out from the doctor's offices. Incredibly disturbing story, and of course a void left in that community now insofar as healthcare services is concerned.